Hi, everyone. Welcome to part one of our two-part webinar series that we are doing regarding how to build a winning team. And we are partnering with DirectDental on this webinar, one of our awesome partners who helps us in the staffing area. So I'm really excited to have Holly Perez with us, who is the co-founder and CMO of DirectDental. Welcome, Holly.
Hi, thank you.
And I'm Jill Hasselman, our SVP of Strategic Partnerships, and very excited to get this content out. As I mentioned, this is going to be a two-parter because what we did was we went through common questions that our team members on our HR advising team have been getting from our clients. And we compiled all of those questions together and we worked with Holly to come up with this content because so much of it is around how do I find people? Where should I be posting? What's the best way to post? And so we've split it into two parts where today we're going to go through who Direct Dental is, what their focus is, of course, and how do we have a focus for retaining our team so that we are hiring for growth as opposed to replacing. But of course, we know that you are having to replace some of your team members just because of the way that the market is right now. And so we'll start to go into where to post jobs, how to do that, what best practices are there. And just kind of a shout out, although Holly is with Direct Dental, this content really applies to the tips and tricks that anyone can use, whether you're an optometrist or working in a vet practice, or again, of course, dental. Lots of really good things that Holly's going to give us, which is a nice segue because the first thing I want to do is allow Holly to introduce herself and give some background on what she's been focusing on because really she is the expert in this area of how do I find people? Why can't I find them? And so, Holly, I'll kick it to you to give a little bit of intro before we dive into the meat of this.
Great, thank you. Yes, I am one of the co-founders of Direct Dental, and when I co-founded it, I was the one that brought all the knowledge of recruiting and staffing to the team. And my main goal when I created this company was to give dental practices all the tools that giant DSOs have to staff their jobs. So we give dental practices the ability to post their jobs across all the major job boards and then can track applicants within our recruitment tracking system. And then we have recruiters as well that can assist dentists with all of their staffing needs if needed. But the reason I have a lot of knowledge in staffing is my everyday, all I do is talk to dental practices that are looking to hire, talk with dental professionals that are looking for jobs, and then working closely with the job boards to figure out how to get jobs optimized and seen. So as Jill mentioned, yes, a lot of this is dental related, but a lot of these tips and tricks we're going to talk about are really going to translate to anything that's in the medical field. So we're answering all of those common questions for you today. And I love partnering up with HR for Health because I do everything I can to get those applicants hired. But once they're on your team, Jill and her team are who you want to be talking to stay compliant and help retain your talent long term.
Yeah, and that's our goal at HR for Health. We have built a proprietary software that really is just for these kind of niche industries, whether that's dental, optometry, med spas, really anybody in the medical space to help them easily manage their team once they are ready to hire that person, which is why it's such a nice synergy with Direct Dental because we want to make sure that you're doing things correctly and we make that as easy as possible to do, but Direct Dental really has the expertise on how to find those people and also setting the stage for even when you're getting ready to hire, how do we make sure we're creating an environment on that is allowing our team to see that we care about them. Investing in an HR technology is a great way to do that, where they are able to see what their sick hours are, their vacation hours, easily clock in and out regardless of how they're paid, doing performance reviews, all of those sort of things that are built into our system, which is, a nice kind of segue that, what questions that we get all the time, and I know Holly, you do too, which is, all right, what do I do? Even though I might be finding people and getting them in the door, I'm not able to retain them. They're churning pretty quickly. And so what do I do with that? And so Holly, I definitely want you to be able to speak on this piece because that's, you have a lot of stats around that. And so Holly, I'm going to let you jump into this piece of really what is turnover costing us and what do we do about it?
Absolutely. And I think that is one of the biggest hindrances of growth within a medical practice. If you are constantly having turnover, it makes it very hard for you to focus on all the other things that you need to do to make your practice grow. And it's funny, I was teaching a CE course just last month, and I had asked everybody, have you had an employee that you had that quit on you that you wish you had done more to retain? And over half of the room raised their hands. And when I asked why, there was some really great stories of, oh, they were a great person and they had a lot of passion for the patients, which is phenomenal. And yes, you absolutely want to retain those people as much as possible. But kind of sadly, the majority of them, and this is just summarizing here, but they had said if I had just given them the raise that they were asking for or had met, whatever they were asking me for, I would have saved myself so much money, so much time, so much headache. And I think that it goes for all medical practices, especially in the dental field. It's extremely costly to be short staffed and extremely costly to have to hire. So if you're looking at this chart, I would say dental professionals, they fall into the skilled hourly and the professional position type. So meaning just to replace someone on your team, you'll be looking at 75% up to 125% of their annual salary. And this includes utilizing recruiters or costly job boards, the time it takes to write and post jobs, to hold interviews, the time it takes to onboard and train. That all adds up. And then being in a dental practice, it's extremely costly because everybody's roles are so specialized for their position within the practice. So being short staffed, it can result in loss of production. You end up with disgruntled and overworked employees, which can ultimately result in even more turnover. So we don't have the means to track the exact cost of what being short staffed in a dental practice is, but tens of thousands of dollars, I think is putting it mildly. And then again, that constant turnover, it's just costing you growth because you're focusing on that instead of everything else that you need to be focusing on. So we really want to focus on retaining your talent. And we're going to keep talking about this for a little bit.
Yeah, and really the first step is when we are onboarding a new employee, we want to think about I'm onboarding this person to keep them. I'm onboarding them to retain them. I'm not onboarding them necessarily to get a warm body into the office so that they can see my patients. That is a byproduct of it, of course, but these fundamentals that go into retaining your team start even from the interview process, which we're going to talk about. And Holly has some really good tips on, how to communicate, speed of communicating, but that needs to translate all into, okay, now I've hired them. I'm going to give them just as much, if not more, TLC than I was during the interview process or when I was out there. And I think that a great question to kind of start and ask yourself with is, if I bring somebody a new person into the office tomorrow, am I ready to actually give the time that it takes to onboard that person? And if the answer is no, that doesn't necessarily mean that you shouldn't be hiring because you might still have that need to place from a production standpoint, but it means you do have a little bit of homework to do prior to that person coming in. Because what we see, and you can see on the left-hand side of the screen, that studies are showing that new hires that go through a structured onboarding process where they know exactly what's expected of them, it's streamlined, they have the communication they need, that they are more than half likely to stay with the business for up to 3 years. And that is, a long-term employee, depending on the position in the industries that we're in, but that is the average of what we're seeing. If the new person coming in and if your existing team sees your goals and sees your vision for the practice and why you're there, which is to deliver great patient care or whatever your why might be, that can really make a difference if they know that from the beginning. So thinking about the fact that the very first day they start, and again, even through the interview process, but definitely that first day they walk through the door, we spend so much time making sure our new patients have a great experience. You want to make sure that your employees have a great experience as well, and that they know what to expect when they come in. Because just because they have a lot of experience, maybe in the industry as a whole that you're hiring for, they don't know your individual practice. They don't know your team. And so you don't want to just assume they might know the clinical skills, but don't just assume they know how the practice is running. And so some things that we recommend here is that right before they start, you're sending them an email saying, this is the details of the first week that you're going to be with me. This is going to be when we want you to come in every day. This is going to be what we want you to wear. If you have a uniform policy, we're going to start the very first day, that first hour of the day. We're going to start with your new hire orientation, which includes your new hire paperwork. We're going to go through the employee handbook, explain your vacation and sick leave benefits, really making sure that they know what to expect, and then putting things in place like 30, 60, 90-day check-ins, which Holly's going to talk about a little bit more in a second, to lay that foundation so they know going into it, I'm going to be checked in with at least 30, 60, 90 days into my time with the practice. And that way, it's not uncomfortable when you are having those check ins. The feedback just seems normal because you started it right from the beginning. And in that, you're bringing feedback from the team, you're bringing feedback from yourself, you're bringing feedback, or you're listening to the feedback from the new hire, so that they really have those tools that they need to have that long-term success. One kind of final note on this that I think we sometimes gets lost in the minutia is if we're expecting a team member to do something specific around goals, and we want to implement goals for all of our team members, you want to make sure that they know what those goals are and that you're explaining to them, here's how, when we're going to check in on those goals, and here's how I'm going to give you the visibility around your work towards those goals. And that last piece sometimes we forget, where it's like, well, they should just know what their production goals are, and they have access to their patients and who they're seeing, and that can make or break how easy you're making that person's job. How much how many systems are you giving them, or the ease of use for them to actually do their job day to day, so that they feel accomplished and they know what they're contributing to. So very important on this piece to make sure if you're going to bring somebody in that you're actually ready. It doesn't just stop with the interview process. It really starts once you hire them and they're ready to come in. And I want to kick it to Holly too, because she has a lot of tips on this piece too, from what she's heard from her clients, on how do you make this successful from the beginning.
Yes, thank you. And to kind of spin off of your point of the 30, 60 day, 90, schedule those in advance. Don't just
Yeah,
spring it on them. Be like, hey, jump into my office. We're going to do your 60-day review. They need to
exactly.
know in advance when that meeting is going to be so they can mentally prepare themselves for it and have their own talking points ready for you. So don't
And
just
on the
spring
flip side, if you tell them you're doing a 30, 60, 90-day check-in, make sure you're doing them.
doing them.
Sometimes
Yeah.
like, oh, we're busy, I'll get to it later. That new person it should be, and hopefully is prepped. They're looking forward to that check-in. They want to know, they want that feedback. And so
You need that
not
feedback.
following through with that is the first way to lose trust and have them say, all right, they're not investing in me.
Absolutely. Yes. Yeah. And they need that feedback. So you need to make sure you schedule them in advance and stick to those. Absolutely. But also there are other tips and tricks to help retain your new employees. And I ask my clients, the ones that I get them someone hired and those people never leave. So I've asked them, I've asked consultants, what are you seeing that's really working well for your practices? I worked with Jill and her team to kind of come up with all of this insight on how to make your onboarding process so much better. So here's just some of them. Number one, make sure that their role is clearly defined. This definitely goes off of what Jill just spoke about, but have that all in writing. The very first day, you're going to review their role with them, go over it in great detail, have it all in writing, have them sign off on it. They get a copy, you get a copy, and then make sure you introduce them to everybody on the team and you clearly define all of those roles as well. They need to know who everybody on the team is and what everybody's specific role is, so they know exactly who they can go to if they find themselves with a question. But it just makes it so clean and easy for them to step into what they're supposed to do on a daily basis with no gray lines in between to cause any confusion. They map out at least the first 2 weeks. As Jill mentioned, it's so easy, especially in dentistry or any medical practice. Oh, you're a dental assistant, get to it, you know your duties. But you don't want to do that. You want to make sure they know exactly what their role is within the practice, and then you want to map out when you're going to meet with them throughout the first 2 weeks, just to connect briefly with them, to give them any feedback you have, get any feedback from them. But again, make sure you're scheduling those in advance. So Wednesday at 2 o'clock and Friday at 3 o'clock, we're going to meet just for 10-15 minutes, just so you can, give me any feedback about the practice. I can give you any feedback about what's going on. And then they know, okay, Wednesday at 2 o'clock, I'll get to talk to the doctor or the office manager about this. Give your new hires a buddy. This could be someone that's in the same position as them, or in a perfect world, your happiest, most loyal employee. But having someone that they could be instant friends with right out the gate is going to make them extremely sticky. We don't want to leave our friends for a new job. So give them a friend right out the gate. And then this also lets them know, like, if they have a question and they don't know who to go to, they have someone on the team that they're comfortable bugging to get pointed in the right direction. They give feedback probably a little bit more than you think that you should, but anytime you have the chance to catch them doing something right or doing something good, just a quick, hey, I really appreciate it, great job. It goes such a long way. Being an employer kind of makes you slightly scary and unapproachable. So just, having those little open lines of communication, giving some great feedback is going to go a very long way in making that person feel comfortable and wanting to stay long term. And then once you get through the first 2 to 3 weeks, you can definitely cool it down. But as Jill mentioned, definitely make sure you're doing that 30, 60, 90-day review with this new employee. And then for long-term retention, I know Jill mentioned, a great onboarding plan can keep employees up to 3 years. For growth, we want to try to keep these employees with us as long as humanly possible. We want them to retire from our practice. So again, I reached out to a lot of my clients that have people that have been with them 15, 20 plus years, just to say, hey, what are you doing? What kind of insight can I give people to help them with long-term retention? And this is definitely the feedback that I got. Give your team the ability to be creative. Again, in a medical practice, a dental practice, it could seem challenging because everybody's roles are so fit into what they do. But what we find is the passionate employees, they love to solve problems and they really want to share their ideas and opinions with you. So to prevent them from seeking opportunities elsewhere, you just want to foster that need for creativity. So for example, you can ask them to assist in marketing efforts or managing the social media for your practice. If they ask for a raise, say, hey, let's sit here together and brainstorm ways that we can increase production to justify this raise. If production's low, invite them to just suggest strategies for improvement and ways to bring in new patients. But regardless of their position, your employees are really going to appreciate the fact that you trust them enough to come to them, ask for their insight, implement any of the strategies that they suggest to you. It's going to be very meaningful, and again, give them that creative ability to kind of shake things up within their role. Another one that a lot of my clients that have really long-term employees, they just try to provide the best pay and benefits that they can compare to all the other dental practices in their area. It's costly, but I hope from a few slides ago you understand now that it's not as costly as turnover is. And what you find is that if you're just offering better pay and benefits than all the other practices around you, it makes it very hard for your employees to leave for a better opportunity. And plus, what we find is that it shows your employees that you genuinely care about their well-being. So it can be a better benefit, could be something as simple as offering one mental health day per quarter. It just makes a big difference on how your employees perceive you, as well as your commitment to their well-being. So, just coming up with some great benefits is going to have a huge impact on them staying long-term with you.
And I think another piece on this that we see very commonly on the HR for Health side is because we, write the employee handbooks for our clients, and then we also set up the tracking of what those benefits are listed as. We see a huge discrepancy when we start working with a client on they have one thing in writing and they might be doing something completely different. And again, those little things can create a sense of distrust, and or for a team member going, well, I don't really know what I'm going to get today. If I don't have very clear visibility into what that pay and what those benefits are, it's not as useful for me. And so kind of doing some reflection and thinking, okay, is what I have in writing what I'm actually doing, and vice versa? Am I making it very easy for my team to know what their time off is? And especially to Holly's point, I absolutely agree that giving better benefits the longer that they stay, but then making sure they actually get that. So you have a system that knows, oh, this person's been with you for 5 years, they get another week of vacation, and that it's automatically doing that. And or you are making sure that you're holding up your end of the bargain in terms of what you're telling them they get.
And just to kind of spin off of that, don't make them feel guilty when they need to use their time off or any of their other benefits. We see that a lot in
Yeah.
dentistry in particular. Like your dental assistant has this week of paid vacation, they want to use it, but then they're being greeted with, oh, well, then we need help finding a temp, or how can you do this? We have a busy week coming up, which just kind of causes a little bit of resentment, I think, on their part, because you gave this to them as a benefit and now they feel guilty even utilizing it. So
Yeah.
just do not do that.
Mm-hmm.
And Jill already kind of touched on number 3, but yes, give better benefits the longer that they are with you. What I've been seeing lately is that some of my clients, they'll add a week of paid time off every year that that employee's with them, up to like 5 or 6 weeks even. It's just 5 weeks of paid time off is very hard to leave. So an employee that's been with you for 5+ years, they're probably not going to go anywhere anytime soon, because they want to make sure that they keep that 5 weeks of paid time off.
Completely. They worked hard for that.
They did. They earned it. And you're showing that you really, truly appreciate them for sticking with you by giving them that reward, which is huge. Another thing I've been seeing as of late is that dental practice are starting to give a percentage of ownership of their practice if someone's been with them 10, 15 plus years, which I think that's a very kind, generous offer. But what they do is that small percentage that they give, that employee will then get an annual bonus. If the practice sells, that employee gets a small chunk of change tied to that percentage that they own. And this does 2 things. Those employees that work up to that rate, they are not going anywhere with you. They're going to stay with that practice until you sell. And what it also does is new employees that are entering, they're thinking, oh my gosh, if I stay with this doctor for 10, 15 plus years, I'll also be a small owner of this practice, and they're going to want to stay with you so that they get to that point. So this is a fantastic way to alleviate any option of somebody wanting to leave your practice anytime.
Yep.
And I don't know all the legalities of that. So again, work with Jill on her team if that is a benefit that you want to offer in the future.
Yeah.
Another thing that they do is they create opportunities for personal and professional advancement. So it's just human nature for people to get bored, especially again if they're a very ambitious, caring type person. So you're going to find that your really strong employees, they're going to seek opportunity for growth within your practice. As Jill mentioned before, you want to really provide clear paths for them to hit their goals. And you want to really work with them closely to encourage them to hit those. Within a dental practice, again, it can be like, what do you mean they're a dental assistant? That's their role. What could they work their way up to? But this little, it's kind of small, but I kind of listed out what a dental assistant's path within your practice could look like. So you hire them on as a dental assistant, you work with them and maybe even help them slightly financially for them to become a registered or certified dental assistant. After a few years, you could then bump them up to a lead registered dental assistant in your team, and then eventually the team lead, and then eventually the back office manager. So if you have these goals readily available to them, written out how they can hit those marks, and then you're working closely with them to move them up into that next step within your practice. Again, that's going to make them very sticky, especially those ambitious ones that really want that back office manager title. Be a mentor. We're finding that nowadays, especially with the younger generations, people don't want to work for a boss anymore. They really want to be somewhere where their employer genuinely cares about their growth and their future, and they see themselves more as a mentee than an employee. So just adopt a mentor approach within your practice. You want to, be supportive, have an engaging work environment. What do they care about? Make sure you implement that within your practice, and that's just going to help retain their loyalty. Don't micromanage. Nobody enjoys it. Jill, do you like being micromanaged?
No,
No.
and I want somebody to tell me if I'm micromanaging too.
Yeah, that's true too. You never know if you're like breathing down someone's neck.
I know.
But yeah, it kind of goes back to like the mentor mentee thing. They just want to know that you trust them and that you believe in them to do their job. So show them what they have to do, have them prove to you that they can do what they're supposed to do, and then leave them be and check in on them periodically. But just have that trust for them. And then again, I'm always going to go back to this. Just be vocal with praise. Some people aren't like, I know Jill's not really into like getting feedback given to her all the time on how great she is. But I
Just
think
public recognition makes me uncomfortable, but I have to be aware of that for the people that I manage and know just because public recognition might make me uncomfortable doesn't mean it makes them uncomfortable. And so I have to train myself to give them company-wide shout outs so that because I know that they like it.
people, and I'm the same way, but just a great, hey, you did a great job with that patient, or the way you handled that person that was upset. Fantastic job. Thank you so much. I really appreciate you being on the team. So it doesn't have to be a big shout out, but just
Yes.
small little thank yous here or there goes such a long way for their happiness within your
Yep.
practice.
Yep.
All right. So if you recently purchased a practice or you're building one from scratch, the road ahead can be daunting. I had a friend of mine who bought a practice and she called me every day crying for like 6 months.
Uh,
I know, it was
it
so sad.
gets better.
It was great once she like got through it. So stick with it. And while Jill and I, we can't help you with everything that you got to do in building a practice. We can help you on the hiring and the retention side. But my first piece of advice, don't panic. Cry if you must. But then pick yourself up by your bootstraps because it will pay off in the long run. Second, make sure you have everything in place so that you can employ your people in compliance with your state labor laws. So best practices would be have an employee handbook. There you go, HR for Health.
Yeah.
And then, a payroll company as well. I think HR for Health does that too. But have everything in place so that way you're ready to employ once you onboard your new hires. Hire based on your needs. So if you're a practice if you bought a practice and there's already patients in place, if I were you, I would focus on having a very solid office manager first, and then would move on to an assistant and a hygienist. And the big thing with the office manager, it's simply so that they could assist you in hiring all the other positions while maintaining that patient flow for you and making sure that the money is still coming in, because money's not coming in, your practice is not growing. If you're building from scratch, meaning you open, there's no patients involved, I would definitely focus on finding a cross-trained dental assistant, someone that can manage the front for you as well as assist you with patients. And then as your schedule starts to get built, hire on that office manager and then the hygienist. Outsource what you can. First of all, you can outsource all of your hiring processes to me and my team, and we can help you with that. But there's so many other things that you can outsource too. So for front office, for example, there's companies that will do all the insurance negotiations for you. They'll do the insurance verifications and the billings. There's companies that will answer your phones for you and assist you in scheduling new patient appointments. Working with a marketing team to do everything that needs to be done to spread the word about your new practice. I would definitely start looking for companies that you could work with to do all of those things just to help you grow your practice and keep your stress levels lower, because you know somebody's handling all that stuff for you. When hiring, it is a huge benefit to new employees that they actually get to build the practice for you. So when you're posting your job and when you're interviewing them, you really want to sell them on that. Like, we are going to be building this thing from the ground up. You're going to have so much say in our systems that we're going to put into place. And people really love that and they want to be a part of that. All the while you're doing your interviews, just make sure this is somebody that you also want to be building your practice with, because hiring right from the beginning, again, we'll go into all of these interview questions that you should be answering, but hiring the right person from the start is going to have a huge impact on the success of your practice. Again, kind of already touched on this with number 2, but just when you do hire and onboard, make sure you follow all the steps we discussed a few slides ago. You want to stay compliant with your state labor board, and Jill and her team are definitely the way to go to make sure that you do that. Lastly, again, do not panic. Once you get through this and other parts of growing your practice, it's going to be much smoother sailing and you'll be very pleased with your decision. So let's talk about posting jobs, right?
Yeah.
So in my humble opinion, posting jobs, it's definitely an art form, especially in this marketplace. I think everybody would agree that hiring in the dental field, in the medical field, has just become more and more challenging. And so we really want to write an ad that's going to get the applicants in the marketplace to want to apply to our job. So we want it to stand out. We want it to interest them, catch their attention. And so what we want to talk about is, where do I find the information that I need to know in order to make my job posting intriguing? So let's talk about where to find out information on what's going on in the labor market. One of my favorite tools is Dental Post. Every year they publish a salary survey report. So these numbers here we're going to go over are from the beginning of this year. And as an employer that's looking to maintain and grow your team, again, this is something you really should be looking at every single year. I don't think it's going to surprise anyone, but pay wages went up yet again this year. It's been a consistent trend. But the point of this slide is to look at who's going to be looking at for a new job and why. So if I was a dental practice owner, I would want to know, does my hygienist fall into this 42% of hygienists that are or might be looking for a new job this year? And if so, what could be done to retain them? So if you follow Jill's advice, you do your reviews often, you make sure that their pay wages are where they need to be competitive in your market, you're probably pretty safe, but it never hurts to just check in with your team on this. If you haven't talked to your hygienist in a while to make sure they're happy, or you haven't made sure their pay wages are where they need to be, now is absolutely the time to do so. You do not want to be without a hygienist in this market. And the big thing is we know that over 30%, they're looking for a new job because they are looking for higher pay wages, and they are looking for a better work environment. So just make sure your team has that and they're happy and content. Now, if I was a dentist that was looking to hire, I would need to know, okay, how do I write a job advertisement that conveys I can offer better pay and a better work environment with all these other benefits that they're looking for. And then not only how do I get it in front of the 42% that are or might be looking for a new job, but how do I also get it in front of that 58% to maybe lure them over to be working in my practice with me. So we just want to get that job posting in front of as many hygienists as possible. And very similar, dental assistants, they are also looking for better pay and a better work environment. So if you have a dental assistant you love, check in with them, make sure that they are happy and content with your practice. And then if you are looking to hire a dental assistant, how do you write an ad that's going to convey that you can give them what they want, which is better money, better work environment, better benefits. We'll talk about that in a minute here. A few more stats for you, just if you're curious. 57% of dentists plan to or might look for a new job this year. 36% saying they wanted better pay. 31% said they wanted more appreciation. And for admin support, this is your office managers, treatment coordinators, receptionists. 64% said they plan to look for a new job this year. 42% saying they wanted better pay, and 33% saying they wanted a better work environment. So since it seems like everybody wants better pay, let's talk about pay rates for a second. So big thing, everybody's looking for better pay. How do I know what is relevant in my market? Don't overthink it. Head to a job board that you know and trust, type in the position you're looking to hire for, and type in the zip code and see what all of the other offices in your area are offering. And in a perfect world, you can add $1 or $2 to that before you post your job, so that way you're the top paying dental practice in your area, which will have a huge benefit to get you more applicants than anybody else in your market. This just happened to be a happy accident, but if I was one of those hygienists that fell into the 33% looking for a new job, I'm looking at Hortonville versus Appleton. I think I'd be applying to Appleton. What about you, Jill?
I think I would too, yeah.
Yeah. So I have a feeling Appleton did exactly what I just said. They went to the job boards, they saw what everybody was offering, they said, I can do better, and then they posted their job accordingly. And I guarantee you they are getting more applicants than anybody who's offering less pay than them. Mm-hmm. And I want to take just a second here to point out that these are advertisements. So we're advertising. And I usually like to use the analogy of buying a car. So car advertisements, they usually have this starting at price when they're marketing one of their cars. Has anybody ever actually bought that car at that starting at rate? Jill, have you ever?
I mean, the starting rate is like without automatic windows, no backup camera. You know, once you start to add those things on, it starts to raise the price for sure.
It does, but has it ever stopped you from purchasing that car once you've made
No,
the money?
I still have the car, and sometimes I did add on all the bells and whistles because it was like, wow, this is worth it.
Bells and whistles are worth it, and that is it exactly. So we're using the advertisement with that higher pay to get them in. They get in. We're then able to sell them on everything else that's so wonderful about our practice. We're able to explain how the benefits we give them as well add to the monetary overall cost of employing them, and then we're able to offer them a pay rate that's more in line with what we feel comfortable offering them. So again, you're advertising, go with that higher pay rate, get that applicant into your office, and then sell them on all the bells and whistles and get them to the pay rate that you feel comfortable paying them. Mm-hmm. Another point I want to make, because I interview applicants every single day, I always make my clients do these kind of larger pay rates for their market. When I interview the candidates, I always ask them, what are you looking for pay wise? And it usually falls right in that middle of the road within the pay range that we have presented on the job board. They very rarely ask for that highest pay rate. So again, just put that top dollar on there. You'll be pleasantly surprised with the fact that you'll get more applicants in, and then you can negotiate accordingly.
Yep. And Holly knows I love this slide because it is such a smart little trick for how to get more traction on your job postings.
Yes, and if you were on our last webinar, this was the only slide that I used the same of, but I will probably always include it in every single webinar and
It's a
training
great
that I do.
reminder.
Everybody should have this screenshot, should have it handy for them. Because here's the truth of the matter is the jobs that have the most benefits listed get the most applicants. And they don't have to be your traditional medical, dental, vision, 401k. You can really get creative with these. So guilt-free paid time off. People love seeing that they can, like I said earlier, people always feel guilty when they have to take time off. So just putting that as a benefit is huge. Renaming your sick days to paid wellness days or paid mental health days doesn't cost you anything, but just that change in verbiage changes the mindset of the applicants and gets them excited to want to work with you. So just keep this handy for when you post a job. For different specific positions within your practice, they're also looking for different benefits on the job postings. So for dentists, you'll want to add benefits such as clinical autonomy, daily guaranteed rate, advanced technology, partnership opportunity, if that's something that you can swing, and then access to a highly skilled and trained staff. Those are benefits dentists will be looking for. Hygienists, the number one thing hygienists want and need is flexibility. So I always have my clients, when we post an ad, I list out all of the hours with a little asterisk that says, if you can work one or more of these days, please apply. In some areas, that's really the only way you're getting applicants, because most hygienists are only wanting to work 2 or 3 days a week max. And then they want to be a part of a practice where they're respected and valued as a provider, much more so than just a producer. They're looking for tools and systems that will help prevent burnout and backaches. A lot of hygienists that left the field, I ask why. My neck, my back, I just couldn't physically handle it anymore. So having systems in place to help alleviate that is going to be a huge selling point for them. And then, as I mentioned a few slides ago, a lot of them are really looking for a better work environment, again, where they feel valued and appreciated. Dental assistants, unfortunately, with the cost of living and how much they make, many of them are very much focused on bringing in an extra dollar or two. So we're seeing that they're always looking for better pay, but they're also looking for a better work environment, and they're looking for ways to advance within their careers to work their way up to a better pay ultimately. I don't think they like this job hopping. I think they want to know, okay, my doctor said if I do X, Y, and Z, then I can work my way up to a lead assistant and get paid this much money. So again, just having ways for them to grow within their career within your practice is going to be a huge benefit to them, and make sure that's listed on your job posting. So as mentioned multiple times over the last couple of slides, writing an advertisement, it's basically a commercial for your job. And we don't have the means to like do $1 million video production or anything like that. But we want the format and the structure of the ad itself to be very easy on the eyes and something that grabs their attention right away. And so this is a format that I really love my clients to use. So first off, very big and bold up at the top. We're getting people's attention in this world of social media. Everybody's attention span is so short nowadays. So we want very first line to read, what's the position? How great is our practice? We're saying here our practice is very fun and friendly. We have the location built right into there, our very competitive pay range. And then we have a call to action, which is check out our benefits. And that's going to grab their attention and then force them to want to keep reading your ad. Then just a nice little blurb about the practice. And then we have the hours, the benefits, and the duties laid out very easy to read. And those benefits have a very strong positive verbiage behind them. So, an opportunity to change the lives of our patients. They have that listed as a benefit. Guilt-free paid vacation is there again. So, just taking a moment to not only just list great benefits, but make those benefits sound as amazing as possible is going to do wondrous things for getting people to want to apply to your job. So let's now talk about where to post jobs. I'm going to kick it back to Jill real quick. She's got some
Yeah,
tidbits.
just a reminder for all of our clients that are on this webinar that we provide over 150 job descriptions in the software. So this ranges for all different positions and all of our different medical industries that we work with. Um, every single new hire is assigned a job description right when they start in our system. And so it might seem like an afterthought, but just remember we do have all of these listed out for you. They can be customized, but that's a great place to start. Where when you're looking to post a job, you can pull from those, and we already have those preset. Again, of course, they can be customized for your practice, but they are very robust and a great little archive for you within the software. So just don't forget about those if you're a client. That can skip a lot of steps that Holly's talking about and really make it where you can just focus on making that job posting and advertisement like Holly's saying. So just a reminder, don't forget to do that and use that resource that you have as a client. So let's talk about where to post, Holly, because this is also, where are the people? How do I find them?
They're everywhere and nowhere, it feels like. But yeah, so if you've taken the time to write a great ad, there are various tools to help you spread the word. And in my opinion, in this market, we want to use as many tools as possible to spread the word about your job. So little tidbit about me, I got my degree in marketing, and the biggest thing they drilled in our heads over and over again is get your product seen by as many people as possible. It's a numbers game. And I agree, it's the exact same way when you're posting a job. So, what we want to do is have that job posting that's great, gets their attention, gets people to want to apply, and then let's put it in as many places as possible. So, my approach to job boards in particular is get it on as many job boards as we possibly can. Obviously, you're a busy dentist or office manager, you don't have the time to create and post your job on hundreds of different job boards. So when you are looking for a place to post your ad, try to find a recruitment service that offers you programmatic job advertising. What this basically means is they're going to use technology to buy, distribute, and optimize your ad to get you on as many job boards as possible and make sure that the budget is where it needs to be to get as many applicants to your job as possible. Also, when looking for a recruitment service, use one that's going to email blast your job out to all the candidates within their database in your area. This is a wonderful way to get your job in front of those that might not be searching the job boards. But again, if you took the time to write a great ad, you could possibly lure them over to apply to your job. Your social network, this consists of your study clubs, classmates, previous and current colleagues, employees, your local dental assisting and hygiene schools. Basically ask everyone if they know anybody that is looking for a job. This is a rare way to get applicants, but in my opinion, it usually yields the best employees. So this is not a step to be missed. Then you're going to turn to your social media. Obviously, you're going to post your job on your office's social media sites. You can ask a tech-savvy employee to make some fun reels or images. Go to Facebook and LinkedIn and just go into the search function and type in your area and the job title you're hiring for. You can then post your job in all the Facebook groups that come up. And then on LinkedIn, you can message anybody who pops up, any profiles that pop up, you can request to friend them. And in the little message box, say, hey, I got a great job for you. Here are the details. Let me know if you're interested. Again, a fabulous way to get your job in front of people that might not be looking, but you did such a good job with writing a fantastic ad that they're like, you know what? I might leave my job for this one. And then you've got an applicant that could be converted into a great employee.
And can I just say, from the Facebook perspective, I'm really not on Facebook that much. When I am, it's pretty much just from the, dental groups that we are involved in. But I always see on these groups when somebody is posting looking for somebody, it's like two sentences of what they've posted of just, and I know Holly, you have some good insight on that of what they should or shouldn't do. but you can tell kind of the effort that they're even putting into that just from the Facebook post of, practice located in this area, $40 an hour. It's like, okay, well, what else? Or it just shows like, okay, you put maybe 2 seconds to type that in and post it on Facebook. And so I'm sure, Holly, you probably would say it makes a big difference to actually put that time and effort just as if you're posting anywhere else.
Yes, exactly. So, I always, whenever I do these ads, my very first line is something fantastic about the practice. So, our our amazing practice in Wilmington, North Carolina. I don't even know if that's a real city, but um, Wilmington, North Carolina is looking for a dental hygienist to join our fabulous team. We're growing. If you are looking for a new position, here's what we're offering. If this interests you, please email me or message me. But yes, you have such a short window to grab their attention and interest them, and you don't want to waste it on a dental assistant, 40 $20 an hour email to apply. It's not going to get the job done.
Yeah.
Yeah. And I can help you with that if need be. So thank you for bringing that up. And I usually like to link it to the job post itself as well. So then that way they can just click on it, see everything else that's great about the position, and then apply. And then it just keeps all of your applicants in one central hub, as opposed to, oh, someone applied through LinkedIn Messenger or someone applied through Facebook. Just try to get them all through to where your job's posted and send that link out.
It's a great point.
Lastly, I still think temp agencies, they're a great option. Downside, they are very expensive, but they have a fabulous network, and they have the means to get your job in front of potential applicants that might not be on the market. And they have the ability to verbally sell your job to these applicants that you might not always get the chance to do. So, great option for that if you're willing to do the extra spend. And then they can also assist you with temps as well if you need additional coverage. So always open to temp agencies. I'm going to do a shameless plug for DirectDental. I mentioned programmatic job advertising, and that is exactly what DirectDental does. So you post your job on our platform. We will then distribute it out to all of the major job boards for you. And then wherever they apply from, it gets sent to your central hub where you can manage all of your applicants through one space. And then we do have upgraded staffing services. So if you want additional support with your social media marketing, reaching out to the local schools, we'll even screen candidates for you if you want. So we do offer all of that to dental offices that are looking to hire.
Yeah, and I have to plug Holly and her team because that piece of the recruiting process is so cumbersome, and it's really hard to juggle that with everything else that needs to go into bringing somebody into just the interview process and bringing them into the office. And that's what we're going to go through in part 2 of this presentation on our next webinar. But just really thinking about, it is so time intensive. There are so many things that are on your plate. It would be really nice, I think, to already have somebody that is vetted by the time that they get to talk to you. And I know HR like the back of my hand. I've been doing this for over 10 years, but I don't even understand how the algorithm works with these job boards and the applicants that are coming in. And we all have our expertise, and we definitely recommend on leaning on DirectDental for theirs in this area. So we're very, we're always happy to partner with them, but this sort of content, it can feel overwhelming to do these things. So I think taking Holly up on our offer is not a bad idea, especially if you're struggling with it. So as we wrap up today, this is the first half, as I mentioned. Part 2, we're going to be going into really the how do we bring these people in? How do we screen them? What's best practices there? If I'm looking at a temp, do I classify them as a different type of employee? Really kind of the nuts and bolts of that, building off of what we talked about today. But as we wrap up, this is Holly's information, her team's information, that we really appreciate her coming in and bringing this content because, again, it is such a need. But I highly recommend at least looking into what DirectDental is doing, and/or stay tuned for our second half if that's what's going to help you make your decision. But it is such an important part. So thank you, Holly. We really appreciate you being on this.
Yeah, thank you. Thank you for having me. And yes, hiring is it's a different animal, especially, if this was February of 2020. We all know how easy things were back then. It's a whole different ball game. In the last webinar we did, we talked a lot about SEO, how the job boards function. So if you
Mhm.
didn't get a chance to see that, reach out to me or Jill, and we can get
Yeah,
that your. But yes, I'm very
absolutely.
excited for part two though, because that's when we get into some really fun stuff.
Yeah. And if you want to know more information about HR for Health, here's a QR code where you can book a demo with our team as well. So we will see all of you for part two on October 10th, where we pick this back up. Again, thank you, Holly, so much for being here, and I look forward to the next one.
Yes, thank you.